Without further ado, now we would begin our session. Let me introduce you to Dr. Neeta Mehta. Ma'am is on a mission to create an inclusive society for children with special needs. She's a pediatric physiotherapist and a handwriting without tears expert with rich experience of 18 years. Ma'am is the director of Sahas Physiotherapy and Wellness Center. A warm welcome to you, ma'am. Before I hand over to ma'am, I would like to tell you all that the session is for 2 hours, 1 hour of knowledge sharing by the expert speaker, and the other hour, ma'am would answer questions from you all. And after 10 minutes, the chat settings would be switched to hosts and panelists. Wishing you all a happy learning. Over to you, ma'am.
Thank you so much for the kind introduction. Thank you, Ms. Shivani. Thank you, Team Ability. Thank you, Ms. Lee, for again giving me this opportunity to present. And I'm going to share my screen and get right into it. So today we are going to talk about strategies and techniques to improve handwriting skills for children with academic challenges or special needs. And we are going to talk about ways to improve handwriting. A short recap. So we have already discussed in the previous workshop about insights into handwriting skills and prerequisites of handwriting, signs of handwriting challenges in children with special needs. And we had started our discussion on strategies and techniques to develop handwriting skills, which we are going to continue further. Today in the workshop, we are going to discuss about the importance of posture in handwriting. So role of posture and motor skills in handwriting, understanding the development of grip and the pressure gradient. We're going to discuss a checklist for assessment of handwriting skills. And then we are going to strategies to improve the handwriting skills. Okay, so what does handwriting help in? So handwriting involves a skill of writing through which children are able to express themselves. Handwriting is a crucial developmental skill for all children. Why handwriting matters? So American Academy of Pediatrics, their policy on handwriting states that developing fine and visual motor skills in early childhood not only predicts writing success, but also improves academic performance of children in elementary school level. That means we have to start earlier where handwriting is concerned, and we have to develop skills so that our handwriting also is better as we move forward in elementary school. Engaging children in regular practice of fine and visual motor skills like tracing, eye-hand coordination activities, scribble time, color or write within the lines, etc., improves handwriting skills development and academic outcomes. So here, in short, we have to know about the components of handwriting, and where we discuss about first formation of letters and numbers. That is understanding how a letter is formed. Like if I want to write a C, where it would start from, where it would curve from, how it is going to come down. Is it going to face towards the right? Is it going to face towards the left? So that formation is important to learn for each letter, for each number. Understanding the spatial relation of each letter and number is also important. As I said, that whether when you talk about reversals, it is issue with position in space as well as spatial relation. Where should I fit the letter in the line? Should it be above the line? Should it be in the middle of the line? Should it be below the line? At which space will this letter fit appropriately? Understanding that is related to spatial relation. Posture is describing about how are you sitting, lying down, or standing, and how is your body in space. So what is your posture while you are doing that particular activity? Pressure gradient is the amount of pressure that you give on the pen or the pencil to write while you're writing on the paper. Is the pressure gradient too light? Is the pressure gradient too much? Or is the pressure gradient optimal? Position in space is, again, as I mentioned, that when you write a spelling, it may be so that, for example, if I'm writing cat, after C, if I've written C in a proper position, if my A is overlapping on the C or too far away from the C, that means I am not understanding exactly which position I have to place the letter A. Similarly, if T comes after A, where is it that I position it so that it looks like a proper verb? We'll be speaking about visual perceptual skills as well, and it involves a lot of things. So as we move forward, we will speak about it. We'll speak about fine motor and gross motor skills today, which are important and which contribute to handwriting development. Eye-hand coordination is again one of the visual perceptual skills, and it is basically, is your eye moving in coordination with your hand? So while writing, you are writing, and if you're looking elsewhere, then your eyes and hands are not coordinated while you are doing that activity. And we are going to see the grip on the pencil or the writing instrument. So let's talk about posture. Now, if any activity requires muscle work to be done, and when the muscle work is being done, if it is being done in any kind of posture, then either there is a possibility that you may get tired of doing the activity if you are using the wrong muscles to maintain that posture, or you may be doing it optimally if you take the correct posture. So posture refers to the body's position while sitting, standing, or lying. So for example, if I'm going to write while lying versus while I'm going to write while standing or while sitting. So which would be the most appropriate posture when I'm writing? Is lying down going to increase my speed of writing or increase my endurance in writing? No, because it is not using the correct muscles that are involved in writing, and there are a lot of trick muscles that are being used which tires you out, and therefore you give up that activity and keep changing positions to move to another posture. This is same standing while writing. It's not a very good posture because your eyes also get strained. You are not in the correct posture to write, holding your instrument, your shoulder position, your elbow position, these all matter. So sitting is the correct posture for writing. Maintaining a good posture will help in proper alignment of the muscles and joints while writing, and will prevent trick muscles or trick movements from occurring. So what is a good posture in writing, and also how the environment can support us being in a good posture? It is essential that both feet should be on the floor so you get enough grounding. If you are grounded, your mind also gets focused onto the task that you have in hand. Elbows should be supported off the edge of the desk, or it should be well supported. Either there should be a side hand rest, or it can be on the table, but the elbows should not hang in the air. One must sit in an erect posture, sit back so the back is well supported on the chair, shoulders slightly forward, and proper desk height. When I say proper desk height, the desk cannot be above the chest level or at the chest level. It can be slightly below the chest level. This is a good posture for handwriting, and it will sustain you for a longer time versus you going into another posture. Second posture that can also be used is where the child is sitting on the floor, cross-legged, with a table in front, but below the level of the chest, the elbows supported on the table well. The care to be taken in this posture is that the child should not be slouched. If the child is slouching and the core muscle is not working properly, then that posture, which is sitting on the floor, does not work. So it is better to give a height or a pillow to the child, not a soft one. It should not be that the child should sit inside the pillow, but a seat which is stiff so that the child can sit on the seat, or a wedge, and then write sitting on the floor in a cross-legged position. So core activation is also one of the important features in posture. Core activation helps you maintain the correct muscles, helps the shoulders to be in alignment, helps the elbows to be in alignment, and then gives you a correct writing posture for your task. Now let's speak about muscle strength. Muscle strength is an important aspect of handwriting. Reduced or poor muscle strength can affect the motor functioning of the joints and the muscles itself. Poor muscle strength leads to muscle weakness that causes challenges in handwriting. So yes, we come across many children who have low tone. So muscles require a particular amount of optimal tone to operate in different areas of life and while doing different activities. If this tone is low and the muscles lack the strength, then our hold, for example, if I start from the wrist, our hold on the pencil or the writing instrument can be affected. It may also indirectly affect the pressure gradient we are using with our writing instrument. To sustain the writing task for a long time becomes an issue if your muscle tone is low, and this will affect the muscle tone at the shoulder level, elbow level, even at the core muscle level, because you will not be able to endure that activity for a longer time. Therefore, muscle tone is important, muscle strength is important, and it is important at the level of proximal, that is your shoulder, which is in your writing, it is not only that your hand works or your wrist works, it is a whole body movement. The shoulder is also working at the same time, the elbow is working in a certain direction, forearm is in a certain direction, wrist is working, and all your fingers are working. So strengthening only fine motor skills does not help in handwriting. It is also necessary to observe the core strength and the proximal strength, the shoulder and the scapular strength, to improve handwriting. Activities to build muscle strength. While we are focusing on the proximal muscles, that is your shoulder and your elbow muscles and your scapular muscles. So activities that you could do is you could stand against a wall and place your hands flat on the wall and push against the wall, keeping your elbows straight, and keeping that hold for 10 counts, and you do it around 5 times each. Doing this before you start the writing task helps to wake up these muscles, and doing it on a daily basis also helps build strength. For children, even activities like crawling, creeping, they increase the shoulder strength, they increase the coordination between the right and the left side of the body. And so one could also explore crawling and creeping activities with children. There is an activity of arm activation, which I would advise all the teachers and the caregivers and even parents to do it if your child is not very motivated for writing or has issues with muscle strength. It may be helpful to wake up these proximal muscles and then make them sit for writing. So I'm going to share a video with you for this, and have a look at this video. So it's called arm activation.
Today is week 12, day 3 of the exercises, and we're going to learn about arm activation. This exercise benefits us in small motor skills, penmanship, cursive writing, creative writing, spelling, operating machines, and increased energy in hands and fingers. This is kind of a tricky exercise in a way. You want to put your one arm up by your ear and hold it straight up. The other arm holds your one arm close to your head, and you move against that hand backwards, to the side, outside, to the front, and then towards your head. You do the same thing with the other side. And again, there's some tension between your hand and your arm. You're trying to move your arm out, to the front, to the back, and then closer to your head. You repeat 3 times on each side, and that's arm activation.
All right. I will get back to the slide now. All right. So that was arm activation. So one of a good activity that you could do with the children before you make them to sit and write. Now let's talk about fine motor skills. Fine motor skills involve the movement of small group of muscles for precise movement. So your small group of muscles involve your wrist and your muscles around the fingers and the thumb. Fine motor skills are important for handwriting and play a significant role in grip development and letter formation. Some of the activities to build fine motor skills are tweezer activities, beading activities, as you see in the pictures, some pegboard activities, word building through sorting. So these are numbers and letters, and the child is sorting using the pincer grip, which is very important for further development of your dynamic tripod grip. Then we are going to talk about visual perceptual skills. Visual perception is the ability to organize and interpret information from the environment using the visual system. Visual means your eyes. Visuomotor integration is the ability to coordinate visual perception and hand movement skills. So putting in a simplified manner, your eye-hand coordination skills, where your eyes and your hands work in coordination with each other. Now, there are several subheads below the visual perceptual activities, but for simplicity, for anything, for any handwriting skill or to know what to write, we need certain skills. We need to understand formations. So, for example, we want to understand what object is similar. So this is the spatial relation worksheet. So where would this triangle fit on between all of these boxes? Would this triangle fit over here? Would this triangle fit over a circle? Or would this triangle fit over a star? No. Knowing that how the borders of this triangle is aligned and where are the similar borders on this square, this makes me understand which space the triangle will go into, and thus the triangle will fit into this space. So this is a worksheet on spatial relation. Then is the copy the pattern. In handwriting skill, one of the things to learn is also about copying from the board, copying from a book. So you copy exactly what is written in front of you. So copying the pattern. So some of these patterns are shown over here. Understanding again the space from where these patterns are arising. They are arising from the middle and going to the corners. This is again making a shape of a rectangle connecting these 6 dots. So I copy the exact pattern. Understanding or color the arrows that are pointing left. So understanding whether a particular letter is towards the right or towards the left. We also need to have this orientation ourselves about right, left, up, down. Understanding the formations. So in each row, circle the letter that is the same as the first letter. Definitely all these are A's, but which alignment is the same as the first one? So this and the third A is similar, and this is the correct alignment. Which is similar in this box. So this is a sleeping bee. So not a standing bee, but a sleeping bee would be identical to this. So understanding identical forms as well. So these are some of the visual perceptual skills which are necessary for handwriting development and also need to be checked when handwriting is a challenge. We will now move towards grip development. A good grip allows the child to keep his or her wrist steady while ensuring fine movements of fingers. A good grip provides stability in writing. Now, we should understand the development of the pencil grasp. At 10 months, development of a pincer grasp is absolutely necessary, or it is according to the developmental age. When you see this missing, then you need to find out the exact reason why the pincer grasp has not developed and what could be the possible reasons that it has. Is it developmentally, is there a developmental issue that is coming in the way of the child? Is it a muscle weakness issue that is coming in the way of the child? Is it neurological? It is necessary to find out if by 10 months you don't have pincer grasp in place. By 12 to 15 months, you usually see this is a kind of mass grasp or palmar supinate grasp. At 2 to 3 years, this is the digital pronate grasp, where you also see children going into mass grasp and holding the crayon and scribbling or coloring. At 3 to 4 years, you have a quadruped grasp where you are placing 4 fingers. So 2 fingers on top, the thumb, and then there is the supporting finger, which is down, the ring finger, which is the supporting finger. At 3 to 4 years, you have a static tripod grasp. Now here, the pencil is in proper web space. The pencil is held and supported by the thumb and the pointer finger and the tall finger. The rest, that is a ring finger and the little finger, would actually remain curled inside when you're using a dynamic tripod grasp, a static tripod grasp. In static tripod grasp, your wrist also works along with your fingers while writing. At 5 to 6 years, this becomes more mature. It is similar, except that now the finger muscles are working more than the wrist, and it is giving a dynamic movement to the grip, to the writing. So it is called the dynamic tripod grasp. We can work either both the ways with static tripod grasp or dynamic tripod grasp. These both are optimal to have. Some of the atypical grips that we observe in children. After a certain developmental age, we already saw the developmental age that at least by 5 to 6 years, we are expecting a dynamic tripod grasp. By 3 to 4 years, we are looking at a static tripod grasp. That is, this is the preschool years. If a child presents at 3 to 4 years with atypical grips like mass grasp, or over here where the thumb is overlapping on the fingers, even this is an atypical grip, then this grip might need an atypical grip might need an evaluation and then further correction. What happens if we continue to write with an atypical grip? It can result in, again, trick movements of involving other muscles, resulting in their fatigue or resulting in certain postural issues. Like, for example, over here, there is humpback. You may also, the way you are holding the pencil and the amount of pressure you are giving, it may also result in cone or callus formations or cocoon formations in your fingers. Also, the way you hold your writing instrument and the writing instrument in relation to the neck and your eyes, this also may affect the power of your eye. So it is necessary to work on the grip in a proper manner. Now, what are the activities to promote grip development? The first and the foremost basic that we could help our children with is something called as pencil pickups or pencil exercises. For this, I will stop share and I'll be demonstrating the exercise to you. So I have a pencil in my hand and I hope it is visible. Is it visible properly, Ms. Shivani?
Yes, ma'am.
Okay. So now I want to first learn only to pick up my pencil before I actually go into the grip part of it. So I will use a thumb and my pointer finger and the tall finger. I will keep the next two fingers, that is the ring finger, and the little finger curled inside. And I will just pick up the pencil and I will drop it. I'll pick up the pencil and I will drop it. Is it clear? I'll pick up the pencil and I will drop it. I will also show it to you from this side, but you have to do it vertically only. Just for demonstration, I will show you in this manner, where these two fingers are coming over here. The thumb is on the other side. The ring finger and the little finger is curled. And where I pick up the pencil and I put it down. I pick up the pencil and I put it down. Right? So this is one of the pencil pickups that you practice basic skill with the children. And the second one is where you can do pencil walks. So you hold the pencil at the corner and you walk over the pencil using your thumb, your pointer finger and the tall man, keeping the next two fingers curled inside. You walk over the pencil. These are two basic exercises that you should start before teaching the proper grip where the pencil would turn over. So for learning about how to further develop that grip, we are going to have a video on Get a Grip. Yes.
Ah, what a grip. It's tight enough so the pencil doesn't fall out of my hand and loose enough so that my fingers can move it. Best of all, I'm comfortable. It didn't develop naturally. I had to learn it. It took repetition and practice. Let me tell you about how I learned this grip. I used to have an awkward grip. I thought I was in control, but it was way too tight. Ouch! My aching knuckles! Then I tried the standard grip. I hold the pencil with my thumb and index finger. The pencil rests on my middle finger. I learned how to get my pencil in the correct position with the flip the pencil trick. Let me show you. Place the pencil on a table, pinch the pencil with your thumb and index finger. Lift it up and flip it around until the eraser points back towards your shoulder. Voila, the standard grip. I also did pencil pickups. I pick up my pencil, make sure I'm holding it correctly, and then I drop it. And then I pick it up again, make sure I'm holding it correctly, and then I drop it again. I did pencil pickups lots of times. I had fun with my new grip. I scribbled, wrote my name, practiced writing, and eventually it became my regular grip. What a grip. One more thing, we're all made differently, so if the standard grip doesn't work for you, then you can try an alternate grip. Here's one. Hold the pencil with the thumb and both the index and middle finger. The pencil rests on the ring finger. By the way, all these grips work for lefties too. Peace out!
Thank you, Ms. Shivani. I'll share screen once more. Okay. So here we spoke about the different types of pencil pickups, pencil exercises, and also you learned about the grip, where it is necessary that the pencil should stay in the web space. It should rest in the web space. You could use a quadruped or you could use a tripod grasp, but the pencil should rest in the web space. It is usually during my practice, I have seen that instead of using pencils which are very long and which increase the weight, it is better to use smaller pencils for children who already have difficulties. So the weight is less and they know where to place it immediately. So this is also one of the thing that you can change while you are correcting the handwriting. While writing, we do if the wrist is going in a certain amount of flexion while the child is writing and he's writing like this, you would like to correct the position of the wrist. Therefore, you will develop wrist extension while writing. And one of the activities to do that is lying down under the table, pasting a paper on the back of the table and writing on that sheet. This will facilitate the position of wrist into extension and also develop that practice when the child actually comes on the table and chair sitting position. Different types of adaptations we'll talk about. So basically, when nothing is working for you, that is the time that you will actually go in for grippers. First, you finish with the pencil exercises, get a grip video practices that you do with the child, fine motor exercises, gross motor exercises, and even then, if the grip is an issue, then you can use something called as pencil grippers. So these are some of the grippers that are available in the market, and there are so many types that are customized to for each issue. In my practice, it's not always worked. So, but there is no harm in trying if it works for the child. So these are some of the grippers where you see they are already giving the pencil positions and the web space position over here and facilitating the grip. They are also providing this handle where you can support your ulnar side of the finger. So the fingers which are on the right side, that is your ring finger and your little finger, these are called the ulnar side of the finger, and they are getting supported by this pencil holder. There are stages of grips. For example, you start practice first in the correct position. Then you start reducing, you want to wean off the gripper. So you have removed one handle over here, and now the thumb is in the position over here. Third stage, you continue to wean off, and you let the fingers do more work. So there are certain stages of grip support as well. I would like to describe a case over here. In my practice, there is a child who has low muscle tone, has come up very well through exercises, and is doing good, is able to write also. The shoulder muscles or the proximal muscle strength is also very good. Now, that is after providing therapy, but the hold on the pencil with the thumb and the two fingers, that is your pointer finger and the middle finger, that is still an issue because the thumb goes into hyperextension. How it has improved, I want to describe to you. So initially the thumb used to go into hyperextension. So when you hold the pencil, it goes backwards. So we had to train it to get it forward. So in that case, we had used the grippers to get it forward to place the thumb correctly. But the result of it is that now he is flexing this thumb, the upper part of the thumb, more than required. So that hurts. So he himself has now changed the position where he is overlapping the thumb on the finger. So for him, the best adaptive device that we could then go for is to use a thicker pencil or a thicker pen, so that the thumb does not have so much place to go into hyperextension instead of using the gripper. So it is very necessary where grip is concerned, the solution has to be customized to each child rather than ordering the gripper from Amazon, without understanding what it may do for the child. So it is very much necessary to understand according to the level of the child. Something else that we come across is the pressure gradient. Now, what is pressure gradient? As I explained to you before as well, pressure gradient refers to the pressure that a child exerts while writing. There are various types of pressure. Either you give too much intense pressure with the writing instrument on the paper such that the paper itself may tear, or whatever you are writing, the impression of it is coming way back. So if you're writing on the first page, the impression of what you have written is coming onto the fifth page. So that is excess pressure. Less or light pressure is the pressure, the way you're holding your writing instrument, but the way you're writing, the pressure is so light that either the writing is completely illegible, I'm not able to understand what actually you have written, and therefore it does not work. So it is not there properly even on the first page. We are not looking at excess pressure. We are looking at what we can do when there is excess pressure gradient. What should we do when there is less pressure gradient? What should we do? We should strive to get the optimal range. And here are the different sample sheets where the pressure gradient is more or the pressure gradient is light, and you have to take an effort to read what is written. Strategies to develop optimal pressure gradient. So let's see, first we want to reduce the excess pressure while writing. So one of this, I have found this useful, making the child himself aware of the amount of pressure he's putting through his joints onto the paper. So we need a whole body mindfulness for it. And I do different exercises to train this. So one of the exercises where, for example, you guys can join your palms together and push your fingers and thumbs so closely and with excess pressure, as much as you can push them, you push them together and get them into a prayer hold as much as you can press. Give it all your strength. And now do not release it, but slowly start reducing the amount of pressure that you are putting onto your fingers, onto your thumb, and slowly start relieving the pressure that you had just put, and make it go light, 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 completely light, 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 before you release it. So you make the child aware that what are you talking of when you're talking of pressure. So when the child is putting excess pressure on the paper, he will understand that this is excess. I have to make it light, 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 step by step. This is one of the exercise. Same thing can be done while pushing on the wall. So push the wall with maximum pressure. Be there and slowly start releasing the pressure, understanding what is high, understanding what is less. It is necessary before any kind of correction can take place. So we have to first make the child aware of what is it when we are talking about pressure, and we can do it through modeling. Another way is also using a foam sheet to demonstrate and model. So when the child writes on the foam sheet, if he's using excess pressure, the impression on the foam sheet is going to be quite a bit. So again, that is like a biofeedback. You tell the child to write on the foam sheet in such a way that is with less pressure. The impression starts becoming less until it comes to an optimum. Okay, this pressure is right. So training the pressure gradient on the foam sheet also works. I love this activity and children also enjoy this. You want them to understand that you want them to reduce the pressure. So, you can take A4 size paper, ask them to put it on their head or on their abdomen, and just ask them to trace over that paper. What will happen is, when you trace on placing the paper on your abdomen or on your head, since these are body parts which are soft, you want to protect them, you don't want to hurt yourself, you may purposely try to reduce the pressure and scribble rather than go all the way in. You wouldn't want to tear the paper while giving excess pressure. So you will start understanding to reduce the pressure to not hurt yourself. So again, that kind of feedback is very necessary before we transfer that onto with the written instrument. Carbon paper copying is another strategy that we can use. So we can put a carbon paper under the first page and ask the child to write, and check that while he's writing, where all the impression has come, up to what page the impression has come. If the child writes with too much pressure gradient, the impressions may have come far below after the first page. It may go on the third page or the works again, that the result is for the child to see. So it is under child's control when you are using something like a carbon paper. Again, using a lighter pencil, like you have 2B pencils or dark pencils in the market that are available to increase the pressure gradient when the pressure gradient is light. Similarly, you can use lighter pencils if you are using too much of pressure gradient. So the impression is at least lighter. Now, strategies to develop optimal pressure gradient, increasing the pressure while writing rather. So same way, these are the same strategies I will use. Again, I want to make the child aware through mindfulness that what do I mean by intense pressure? What do I mean by optimal pressure? What do I mean by very less pressure? For a child who's having less pressure gradient, I would use a darker pencil, which is available in the market. I would also train the child on the foam sheet to give more pressure instead of less pressure. I would also train the child on the sandpaper to create impressions. Carbon paper writing such that give enough pressure so that the impression comes on the second page. There is one more activity, like you can use stamping. I don't know if you can see this. So these are stamps. You can put it in ink pads and ask the child to stamp on paper. So if the stamping is light, then the impression will not come completely for the stamp. So you stamp it in a good way so that it is a correct pressure gradient. You get the correct impression. So that is also one of the strategies that can be used. Okay, we have come to the end of understanding how to correct the pressure gradient, and we are moving on to the checklist for assessment of handwriting challenges. So what would this assessment help me? This assessment will help me in understanding the handwriting challenges experienced by a child and to formulate an individualized intervention plan for the child. So we are rating the child's handwriting on the following domains, which we have discussed before. So we're talking about formation of letters like uppercase and lowercase. We want to check. Again, we have to check this according to the age of the child. So if it is a child who is very young, you cannot test for lowercase letters. Size of letters, neatness, speed, posture, pencil grip, visual sequential memory. I also want to explain to you what is visual sequential memory. Whenever a child is writing, if it is a word or if he's copying from the board, or if he's writing a word which he has memorized before. For example, if he's writing cat, he has seen and he's writing. He wrote C, then now he has to remember how was A. Whether he remembers that A correctly, the position of the A, the formation of the A, how do I form this A? What comes after C? That is my visual sequential memory, that after C, A comes. Okay, now I've written A. Now what comes? Again, my memory should supply me with that answer. Okay, now this is T. This is how I need to form it. And this is T that comes after A. What comes after visually? I've seen something visually, I'm copying it. Then it depends upon my visual sequential memory skills, the way I copy and write. Or I had seen it visually at some point and now I have to write. Position in space, that is whether it is up, down, whether the word is in the correct line. If C is on the first line, A cannot be on the second line, T cannot be on the third line. The letters, if they are hanging up and down, then that is position in space. And helper hand, whenever we are writing, writing is a bimanual task. Writing also involves bilateral integration. So when I'm writing, I usually will support the paper with my other hand, which is called the helper hand. If I'm left-handed, I would use a right hand. If I'm right-handed, I will use a left hand. So let's just run through the handwriting checklist.
Yes. It.
Second. Yes. So this is the handwriting checklist. Now, this is the abilities checklist for assessment of handwriting, and you have to score it. This checklist will be done for children between age of 4 and 12 years old. Each response of yes is equivalent to a score of 1. Each response of no is equivalent to a score of 0. So the first component of handwriting, formation of letters. Does your child or student have difficulty writing letters in their correct formation? You have to put it as yes or no. You have to comment on the size of letters. Does your child or student write too large or too small? Neatness. Does your child or student exhibit a poor quality of written work? It may be overlapping. It may be too much of erasing. It may be too much of cutting over the written word. Does your child or student write too slowly and fail to complete the tasks on time? Does your child or student have difficulty in maintaining the right posture and sit slumped with feet unsupported? Does your child or student have an awkward grip, that is, holds a pencil in an atypical grip while writing? Does your child have difficulty in copying the letters when presented visually? Does your child or student have difficulty positioning and aligning the letters together to form a word? Does your child or student have difficulty using the non-dominant hand holding the paper while writing? Now you have to add the number of yeses and no to find the total score. If your total score is 4 or above, it is an indication that your child or student may be at risk of developing the challenges in handwriting, and you may want to consider taking up a formal assessment. This is just a checklist. It is not a formal assessment. This is a checklist through which you will know whether you need to get assessed through a formal assessment too. So it can be used for reference, but not for diagnosis. All right. So this was about the handwriting assessment sheet. So we are going to go over a case now, and remembering this checklist, let's see where do we stand with the case. Okay, so case study. Maria is 10 years old. She has speech difficulties along with learning challenges. She is cooperative and motivated to learn. Let's look at her handwriting sample. And my question to you guys is, what are the challenges that Maria faces? Looking at this sample, wherever through the sample, you can go on the checklist, or you can think where on the checklist can we mark. So you can type your answers in the chat box.
They have typed, ma'am. Ms. Deepa says low pressure. They said identification of the letters, low pressure gradient, not writing between lines, neatness, no eye-hand coordination, line format, very light, poor letter formation, spatial challenges, gripping, low pressure gradient, visual perception, speed, different format of writing, mirror image, low pressure, no eye-hand-eye coordination, alignment difficulties, position in space, too big in size, not writing between lines, pencil grip. Yeah, those same answers are on the similar lines.
Okay, so I agree with most of that, except that I don't have enough information from the sample about the pencil grip. It may be affected, it may not be affected, but if we are writing pencil grip, then we are assuming it. We have not seen it. So from the sample, you should make an assumption of what you see. So yes, I agree with difficulty with formation of letters. I agree with the size of the letters not being too big, so they are not appropriate. The neatness of the letters. Um, so those three definitely. I feel the pressure gradient is also affected. It is not the same throughout. When she has written snake, which is in the in the fifth line on the second on this page, snake and bear. So you see a difference in the pressure gradient. So this also one should remember that the same child may have excess pressure gradient and light pressure gradient. Somewhere he may put too much pressure, somewhere he may put too lighter pressure. So that also needs to be looked into. Great. So great answers and all right answers. So great. So what have we done to assess the challenge that Maria faces? We have assessed, and now what are the strategies we have used? So definitely we have gone for grip correction, because I know for Maria grip was a problem, not that much of a problem, but she had low muscle tone. So the way she held the writing instrument, she was not very motivated to write because the muscle tone was low and she was getting very tired. So she kept on shifting her hands, though she was right dominant. So there we had to work on the fine motor skill, proximal muscle strength, fine motor strength, and then we came to the grip. How did we help Maria first? So we had to go through each stage. So when we talked about formation of letters and the size of the letters, we wanted to first correct the formation. So we went back to the slate and the chalk, and there is a technique called the wet, dry, try technique that is used. So in that, what happens first, you give a cue point over here, that is at the corner of the slate. You write the letter. So we have started with E. So standing line, top sleeping line, middle sleeping line, bottom sleeping line. Then Maria has to use a wet sponge to trace on these lines first, so that she has a wet sensation of these of how to form these letters, and it is sensory in nature. It motivates the child to work. Second, then she uses a dry tissue to reduce that. So she will again trace with a dry tissue on the same thing, and then she will write with the chalk, either if she needs a physical prompt, yes, if no, then independently, till she's able to write this letter on her own. So we used a whole sensory medium of slate, chalk, to teach the wet, dry, try technique. Then we shifted to the paper, where we shifted to big squares, and we gave her the borders that were highlighted properly. So even if on the sheet the squares were already made, they were not enough for her to understand the space. So we highlighted the borders so that she could know that which box she has to write the letters, and this was the result. And slowly, steadily, we moved to smaller squares. Then we moved to the double line book, and then we have moved on to the red and blue line book. This work is still in progress with her. This we could achieve in 16 sessions that was spaced over 4 months. 16 sessions that were paced over 4 months. Yes, 8 sessions in 2.5 months. The other 8 sessions in another 2 months. So 4.5 months we could get this result. But her writing is now legible. We can read it well, and still it is in progress. So we can see what results we get through an handwriting program. Plus, keeping in mind that this is a 10-year-old child with special need who already has a learning challenge, who already has a speech difficulty. So we have to keep that much patience, and we have to allow time for practice for especially the writing skill. My key takeaways from this session to all of you is: understanding the components of handwriting is crucial in the development and enhancement of writing skills in children. A combination of different strategies can be used to develop core skills that are crucial to print writing. And setting realistic expectations and developing individualized plans based on the level of each child helps in developing handwriting skills in children effectively. Thank you so much for being an engaging audience. I I I give over to Shivani. Ms. Shivani, you can take over. I'll stop share.
Thank you so much, Dr. Neeta, for this informative webinar workshop. I'm sure all the participants would agree with me that they have learned a lot of hands-on strategies to help children develop and improve their handwriting skills. So you will now be shared with a feedback link. I request you all to please share in your feedback, where 5 stands for where you loved the webinar workshop. So now you can also check out the links in the chat box that will help you to get access to the resources of this particular workshop and also the slide deck and checklist. Do share it with whomever you think you can benefit. If you have enjoyed this program, do share this program with your fellow colleagues and friends so that they can also receive the same benefit that you have received from Ability Event. You could also share these resources that can help children with special needs improve their outcomes, and also you can join with us to become an advocate in Ability's mission to bring about a positive change in the world. I would also like to inform you all about the upcoming events that are there lined up. On the 15th of March, we have Building Expressive Writing Skills in Children with Special Needs, the basic level. And on 31st of March, we have Enhancing Expressive Writing Skills in Children with Special Needs, advanced level. These workshops would be conducted by Madam Geeta Gopi, and I request you all to book your slots and also forward the links to those who can benefit from them. They'll be conducted at 4:30 p.m. India time, 6 p.m. Indonesia time, and 7 p.m. Singapore and Philippines time. Now we move on to the question and answer round. Are you ready for the first question, Dr. Neeta?
Yes, please, sure.
Great. So now we have a question from our participants who want to know that we have discussed a lot of strategies. So Aga Mohammed wants to ask that, and also Kumari Vikachna, who wants to ask that when we are talking about various activities, what is a suitable age of the child to start implementing the visual perception activities?
So visual perception activities can start at your school level, that is at 3 to 4 years of age also, where you're building the eye-hand coordination activities, for example. But you will make worksheets according to the developmental age of the child. So at 3 to 4 years, the activity would be like level 1, giving you an example of making an eye-hand coordination worksheet, which is for a 3 to 4 year old. So you will draw a house and you will just draw a simple line that goes to the school. It may be just a standing line, and you just ask the child that how is okay, so how is Mr. X going to reach the school? So she draws that line from where Mr. X is standing to the school, which may be just be a standing line. So it is a eye-hand coordination activity, a simple maze, but at the level developmental age of the child. Same way, if you have to make it a little more complicated, where the child is 5 to 6 years of age, you can give some curves and turns to develop that eye-hand coordination activity. For example, say the second visual perceptual skill we are talking about for understanding forms. So for a 2 to 3 year, for a 3 to 4 year old, I will have say a triangle, circle, and a square, and I will have some similar shapes down, and I will say, okay, circle all triangles. So, or circle the shape that is shown over here. I will just put a triangle on top. Below worksheet, I will just give a triangle, circle, and square, and I'll say, okay, circle the shape that is shown to you on the top. So if she sees a triangle, she circles a triangle down. So that is relating or the form or understanding the correct form. You can still make it more complicated, and instead of shapes, you may use something else for a 5 to 6 year old. You can use numbers, you can use letters, you can use different you can use colors and different sequences of colors. So it is according to the age of the child, you can start visual perceptual activities, but the worksheets should be age appropriate. I hope that helps.
Thank you so much for your input, ma'am. Based on the level of the child, the worksheets have to be customized. Now we have another question by Nenita Purto and Lily Chong and others. When they wanted to ask you that, can we still correct a pencil grip of a child who is 11 years old? Is it all right to do so?
Absolutely, but again, I would go in for the assessment. Why is the grip wrong? Is it the strength? What is the issue? Is it the muscle strength issue? Is it a planning issue? Where is the grip going wrong? Then first, I would like to, if I've never corrected it, or I have not used a correct strategies, then you can definitely try using the get a grip strategy to correct the grip, to do the pencil pickups at this age also. Only if this don't work, then you can think of adaptive instruments like the grippers, and then that gripper should be customized according to the child. Or you can go for adaptive writing instruments, that is either it can be a thicker pencil or a thicker pen. So according to that, we have to decide. But definitely you can try the correction.
Thank you so much, ma'am. Now we have another question by Priyanka Avinash, who wants to understand that when can we know that the child has developed their handedness, the left-handedness or the right-handedness, and is it okay to shift when the child has been identified as left-handedness to right-handed?
The dominance is usually well established at 5 to 6 years of age. It is well established. I would not advise anybody to change the dominance once it has developed, or rather, I do not do it even while it is developing. It is how the brain works, and I would not want to play with it. So I do not advise change of hands or changing the dominance at all. I would rather work with what is there.
Allowing the child to continue with their dominant hand that they have developed is the way to go. Thank you, ma'am. Now we have a case-specific question by Meryl Wong, who states that her son has poor handwriting skills. She's trying to help him improve the handwriting through practice, but he says that his hands hurt and he wants to rest. She's tried using reinforcement by giving rewards, hoping that he will improve, but he has not shown any progress. Can you suggest what can be done?
Again, it has to be customized to each child, but say even if I take one point where your child is giving you the feedback that my hands are getting tired, so you check the amount of work that is being given for writing, check the strength of your child, check if there is low tone, check the strength of the shoulder, check the strength of the check the fine motor skills, check the grip, also check the position in which the child is writing. Check the other skills if they are there or not there, because since you're saying that reinforcements are also not working or it is not motivating the child, then the correction has to take place at the level where there is a difficulty, and then perhaps we can address this situation better.
Using the checklist to identify which component of handwriting is being a concern would be helpful. Now we have a question from Maureen, Ken Navako, and others who state that wanted to ask you that does legible handwriting mean good academic performance, and does that mean that illegible handwriting can lead to poor academic performance? And when should a teacher start worrying about a learner's poor handwriting?
So poor handwriting is a result of what? We need to understand that. So is it related to the components of the handwriting? Are they at a right level? If they are not at the right level, then definitely they will affect the academic performance in the near future. So I would definitely say that poor handwriting does reflect academic performance, and it should be caught on early. Poor handwriting also results when attention and focus may be one of the issues and therefore or attention to detail may also be an issue. So again, this all results in poor academic performance, presence of this. So it's better to catch it early on and start working on it. We are not looking at something, I'm not talking about a beautiful handwriting achievement. I'm talking about something that is legible and something that is neat enough for the other person to read. And that is all what we should aim for. I hope that helps.
Thank you for this insight, ma'am. Now we have another question by Sangeeta, who says that how can she solve the proper problem of no proper spacing while writing? Either there is huge space between the words or there is crammed up writing. Can you please suggest a few tips to solve this?
Sure. So this is again related to position in space. So as I said, not knowing how to continue a word. So writing cat, where do you write A after C? So if it is very difficult for the child, instead of continuing to write on double lines or 4 lines, first teach the child in square lined books. Use small squares so that she can understand the spacing that is required between each letter. So the letter does not overlap and it is not far spaced out. Once that concept is caught on, then you move again back to the double lined paper. Second thing is, yes, cue points to help, dots to help, but then you cannot always be present to give those dots. So tracing on the word that is given, that is also one of the second strategies that can help. Proofreading is one of the best strategies for not only position in space, but for anything that the child writes. So once the child has written, you let the child himself correct, show him first how to correct. So while, for example, if he has written I am a boy, and if there is too much spacing between I and am, so then you underline that space and show the child the amount of space that is there. Then underline the space that is left between and am. So you are first showing that you have left too much space or you have left too little space. Then you write it, you yourself model it, you write it the correct way, and now ask the child to copy in the correct way. So the child proofreads, sees the correct way and copies it. Through practice, the child will then learn that, okay, I have to leave only this much space. For me, that one finger space thing has not worked, because somehow then later on what happens when you're leaving one finger space between words, still the space is becoming too huge at times. So I do not prefer to use one finger space, but I used to prefer to line it and show the child where the space is much or where the space is less, and then model it myself. And also the square boxes. I hope that helps.
Thank you so much for this wonderful hands-on activity, ma'am. Now we have a question by Jian, Polina, and Pagvin. She states that there are several students as well as her own son who frequently leaves words or letters or syllables out while writing down, and they feel that they have written it. So is there a way to bring about a sync in them while they are writing without leaving out any letters?
So if correct me if I've not understood properly, but do you mean to say that when you are writing a word like cat, you may forget to write A, or you may hide the A somewhere, or you may overlap it over one another? Is that what she's trying to say?
They forget it, but when asked, they respond that they thought they have written it already.
Yeah, so that is again, that's what is the visual sequencing issue that will contribute to that. So in their head, maybe they have it subconsciously, but when they are putting it on paper, like, to know it from the conscious or copy it well, that may be a difficulty. So we have to work on these visual sequencing skills, and you have to use various worksheets to work on that. But second, I would also look into if there is a presence of learning challenge. That may be that while thinking about it, I can do it while I know the spelling completely fine, but when I'm putting it on paper, I'm not doing it right. Is it related to dysgraphia? Then I have to check for it. and I would need an evaluation for that. So it would be difficult to directly give strategies just knowing this much information.
Probably working on the visual sequential memory can help, but more than that, to understand the other components, we could have a detailed understanding of the child. Now we have a question from Karen Tonojo, who wants to ask you, when is the right time to start preparing a child for writing? How do we know that now the child is ready to write?
So I think at the elementary level, at the pre-K level, already the preparation starts by teaching the child. You are teaching them a lot of patterns in writing, like standing line, sleeping line, slant line. Then you are teaching them certain orientations. It's already the writing part starts at the pre-K level. So the writing readiness starts at the pre-K level. But if you want to check the writing readiness of the child at any particular age or at the pre-K level, there is a checklist that is available and that is shared also in the resource file by Ability, which would be helpful to you to check the readiness at that particular age. But otherwise, writing preparation starts right from pre-K level. I hope that.
From the PK level, the child could be made to write, writing readiness could be enhanced. Now we have a question from Nidhi, who states that how can we correct thumb hyperextension in a child with low muscle tone? Also, by what age can hand dominance be made sure of in this child?
Thumb hyperextension is not related to the dominance. Dominance will be well established by 5 to 6 years of age. So if he's using his dominant hand, and where I have already described that there was thumb hyperextension, which which the child who was visiting me exhibited, I tried first using the gripper, which I have shown in the slide, where I showed him the thumb placement and the pointer finger placement with the middle finger giving the rest and the ulnar fingers in a curl. Now he was also holding an eraser over here. So the eraser was supporting him while writing. So that was one of the way I had used. Before that, I had used writing with marker pens, because marker pens are thick. So it does not allow your thumb to hyperextend as much as if you will use a very thin pencil or the normal standard pencil that is available in the market. Then we had shifted to thicker pencils and triangular pencils, the one which I have shown over here. This is a DOMS triangular pencil. Now several of these thick pencils are available in the market and on Amazon. This does not allow too much of thumb hyperextension. So this is also one of the tools that one can use. So I have used thick pencils and grippers to adapt his thumb hyperextension, but I'm also working on his fine motor skills so that we get the appropriate strength.
Adaptive will be helpful. Thank you for this hands-on activity. Now we have a question from Vinita. As we've been speaking about muscle tone, she wanted to understand how can one assess muscle tone and how to know if there is a low muscle tone in the child.
Usually low muscle tone is assessed by physiotherapists or occupational therapists, and they guide you well to tell you that that the muscle does not have enough power. What a teacher or a parent may see in low muscle tone is the type of posture the child exhibits. Sometimes the child, when he stands, he has locked knees. The knees are hyperextended. The foot may not be in the correct position. There may be flat foot. The way the posture of the child may not be correct. When we stand, there is a proper hyperextension, or there's a lordosis, it is called, at the back of the spine. That may not be well maintained because the core strength may be low. Even the way the child is doing activities and shifting hands from right hand to left hand, because the hand is getting tired, may also signify if muscle strength is poor. Not only in handwriting, for example, opening a box, opening a bottle, picking up a plate, picking up a tray, which at his age, if the child can do and is not able to do, may exhibit some amount of poor muscle strength, some activities that may point out to it, and then you can take them for a formal evaluation to an occupational therapist or to a physiotherapist who can guide you further. I hope that helps.
Observation is the way to go. The more you observe, and if the child is not able to do these little things, it could be an indication and a red flag sign. Then a question from Bakala Priya, Lekha, Tejal, and others who wanted to know strategies that can help improve reversals. So their children are writing in reversals and mirror images. Could you suggest certain strategies that they could use to rectify that?
So I have shared about the gray boxes, basically this wet dry try technique also that I've shared with you, where you could use the slate and the chalk, and where the cue point is already given, where the corner is already defined. So you first teach the child in that manner. That would teach the child the correct formation of the letters, and also it would be in a constrained space, not too much of space that the child has to write. If you're doing it on paper, then you can use those similar size of gray boxes or the square boxes that we showed, 1-inch square boxes. First, you teach the child to write on that, and always, for example, for capitals, they always start at the top corner. They do not start anywhere else. They start at the top corner. So if that top corner or either at the center, but never down there. So if that information is given well and practiced enough, then it will be helpful. For smaller letters, there is a way. So there are certain letters in the alphabet like A, M, N. They all fit into the middle space, and the orientation should be such that, like, if you're teaching M to the child, you're teaching it in double lines. So there is a reference M on the left side. There is a reference M on the right side too. So the child can see on both sides. If it is a B, there is a reference B on the left side. There is a reference B on the right side. Along with it, there will be a letter language. So for example, if I want to teach B, I'm going to say first to a standing line and then go up and turn on the right. When I'm making a D, my letter language will again change over there, where I'll say, okay, first I'll make a C, then I will go up and make a standing line and come down and turn. So letter language helps, reference letters helps, and being in that square boxes where the cue point is already given helps in these changing these reversal patterns. I hope that helps.
Thank you for these hands-on strategies that they could use. We have a question from Binivida, Wal, Lakshmi, Mary, and others who wanted to know what teaching strategies can be used when learners don't have an interest in writing.
First, to understand why they don't have the interest in writing. So the assessment sheet will itself help you. So a sample sheet of their writing, assess it on our checklist, and see that where the challenges are there and correct this challenge rather than focusing on the whole handwriting as usual, and break it into chunks. When a child is not motivated to write, do not give more to write, but break the task into chunks where you're doing 15 minutes of writing in the morning, 15 minutes of writing in the evening. And from there, correct their difficulties, use the strategies to correct their difficulties so that they find it motivating, or they are motivated to write. Until and unless those strategies are put in place for them and they don't know how to do it right, they would not be well motivated to move forward. I hope that helps.
So chunking the information will help it look less exhaustive for the child. So that could be there, and also building a rapport will help, as ma'am stated. And now we have another question by a participant named Lucy Marie Lisudini, who states that education for some countries is still continuing online. What could be some strategies and techniques that can help improve the handwriting of children at home? Can you suggest some materials that are readily available at home that parents can use with their children?
So for online teaching, and depending on the age of the child, there are some materials that I can suggest. So for KG students and pre-K students, if you are teaching, or the formation of letters would come into place for KG and first standard. And if you're teaching the formation of letters for the first time, I would advise you to take the help of the parent and teach them with the wet, write technique on the slate. And that can be demonstrated on the Zoom platform through a whiteboard also, where you are first demonstrating the formation of the letter on the whiteboard, and then the parent is copying it. Then you are erasing it also on the whiteboard. The parent is making the child do it with the sponge, and then the dry tissue as you are telling the parent. You can also make use of objects like clay or putti to make the child form the letters. So the child is interested in that kind of constructive activity to form the letters and alphabets. And then finally move on to the paper model. But I would say when we are doing more of online kind of situation, we need to use more concrete objects that are motivating to the child, and then use the paper part of it. So I think that will work when you're teaching anything. I hope that helps.
Thank you so much, ma'am. You could use these hands-on strategies and see if it has benefited your child. We have a question from Merli Balogue saying that there are still some students in high school who have poor handwriting. What could be the best exercise or strategy to make their handwriting better when they have reached their teenage years?
The strategies would remain the same actually, whether it is a teenage year or the younger child, because again, it is all about assessing the sample, handwriting sample. So when the child has reached, so there was a 10th standard student who I have taught cursive handwriting, and the child had no special needs as such, but the neatness of the writing was getting affected because it was, he had moved to cursive, but he had not understood the loops of cursive well. So we just simply went into practice with worksheets, and we did not do too much. We just corrected those loops, and we practiced it over a period of 2 months till we got good handwriting after 8 sessions. So with teenagers also it is the same. First, find the handwriting sample, see where the difficulty is, and accordingly put strategies and practice into place.
Identifying which formation is going wrong to help the child correct it, as well as practice is the way to go for teenagers. There's a question by Kareem Lizia Mahe, who wants to know, she's a teacher and she's implemented reward system already in the classroom, and she asks you how can she motivate students who don't want to write despite of the reward system that's implemented in the classroom. Can you suggest a few other strategies in which she can be a source of motivation?
So as I had taken this question before also, the child is not motivated because he doesn't know how to correct his challenges. So for you, you are saying that you are giving a reward. A reward is motivating for most of the people or most of the children. Still, if the child is not motivated, you could go a little deeper into why he is not motivated enough. Where does the challenge lie? So the checklist will come into picture over here. Correcting that challenge will come into the picture over here. And then if you correct that challenge, and still if the child is not motivated to write, that's a different thing. But I think first correction of challenge itself will motivate the child to write, and then the reward systems can come into place.
Identifying the right challenge is going to help the child. Now we have a question from Marilyn Kamako, who wants to understand that when we've been speaking about handwriting challenges, is it similar to dysgraphia, and how can we differentiate it that poor handwriting may or may not be under dysgraphia? How can she help her child to write correctly when the child is on the spectrum and the child is 5 years old?
So too many components to this question. One is 5 years old, one is on the spectrum. So being on the spectrum, what are the challenges itself? One needs to assess that. What is the attention span of the child? And how much of distraction, therefore, we have to see and accordingly plan the program. Dysgraphia has many components. I'm talking only about handwriting in print and the components of handwriting in print over here. I'm not touching dysgraphia at all right now. But if you have to teach with a child on the spectrum who's 5 years old and may have limited, I am assuming may have limited attention skills, then I would plan a program in mind where I would take only 3 letters at a time to teach the child, then 3 letters in the morning, 3 letters in the evening, and I would practice till the child gets it right. And I would use a lot of sensory activities also to teach these letters. So I've used the wet dry try technique. I will use the formation with clay technique. I will use the formation on the grains technique. I will use to teach all kind of sensory mediums to teach the formation of the letter, and then I will transfer it into paper and pencil, and I will see how much prompt I need to give, whether I need to give a full physical prompt, whether a verbal prompt is enough, and whether I can wean off the verbal prompt. With a child on the spectrum, it takes time. In our previous workshop, we have discussed various strategies. I would definitely advise you to look into that previous workshop. Also, I would advise you to look at how to do air formation of letters, so that with the child on the spectrum, whole body movements also will come into the picture. So many strategies. First, only to teach formation of letters, and to keep it small, as I said, chunk it according to the child's attention span. So that will motivate the child to do much more. Also, to add on for the previous questions, also when teachers have said that I have created rewards and I've created reinforcers for the child. Also for the child on the spectrum, you could put reinforcers and rewards for task done well. This will motivate the child. For teachers who say that the child is not getting motivated enough even with the reward, once after you find that the challenges exist, the work given in school should be monitored, and it cannot be same for the child who has a challenge versus a child who doesn't have a challenge, because the child who doesn't have a challenge is anyways going to complete the work, and that should be the expectation. But for a child who has a challenge, the teachers need to understand that they need to keep a realistic expectation from a child who has a challenge. The child who doesn't have a challenge is going to write, say, 5 to 7 worksheets, but a child with challenge, the realistic expectation should not be more than 3 to 4 worksheets. This is there has to be a difference initially, then only it is going to be motivating to the learner till the learner reaches up to that 99.9% of the level where he can complete. But the initial challenge cannot be so much. Again, that is going to take the child backward. It will not motivate the child enough to do the work. I hope that helps both.
Thank you for an elaborative insight to this, ma'am. We have a question now by Muskan Wadwani. She wants to understand, are there any tips to improve the handwriting speed of teenagers or children?
Handwriting speed is, I don't have direct tips. Still, all other components get corrected, your speed will not get corrected. So if all other components get corrected, then it is practice and practice and practice, which is going to help the speed of the handwriting. And if there is a lag in visual sequential memory, then you need to correct that. Visual sequential worksheets, visual sequential activities, which will again correct the lag. And if the speed is there because that is lagging, that if that is corrected, your speed will also improve, because the child will now remember from the memory. So you have to work on both the aspects, practice and correcting the visual sequential memory. I hope that helps.
Thank you so much, ma'am. Correcting the components will definitely help improve the handwriting. Now, we've been talking about strategies. So there's this question from Jocelyn Abong, who wanted to ask, while implementing or helping children who are at beginner level or toddlers, is a pencil better to use, or are there any other tools that they could start off with?
At the pre-K level, usually we should start out with crayons, chalks, paints. I mean, you should use a lot of creative mediums and sensory mediums to make them understand the formation. Like the wet dry try technique is an awesome technique, I feel, that can be used before actually going towards the writing instrument, or before shifting to a pencil and paper. At the pre-K level, definitely at the KG level and at the first standard level, you can introduce the papers and pencil as well. but the ratio, like at the pre-K level, use more sensory and less paper. At the KG and first hand level, you can start putting in 50% or 70% paper and 30% sensory.
Thank you so much, ma'am. Since you've been speaking a lot about the wet, dry, try technique, there are a lot of requests if you could explain the audience, our participants, this technique elaboratively as to how they could apply.
Right. Would sharing a video at this point help?
You have that ready with you, ma'am?
I can get it if you give me a few seconds.
If you could explain also, that would be great. Anything that is up to you. If I'm not sure if we would be having the bandwidth, you could try. If you could explain, because many of them you've elaborated and told that wet, dry, try technique could be used, but you could explain them. And also for those viewers who have missed the last workshop by Dr. Neeta, you could also view it on demand, that is available on our platform, where all these techniques as well as other techniques have been told beautifully that are hands-on, can help and develop the handwriting skills. Yes, Dr. Neeta, go.
Okay, so wet, dry, try technique, you can use a slate and a chalk. You need a sponge, you need water, and you need dry tissue. That is a paper napkin. In the wet, dry, try technique, what you are trying to do is you are teaching the formation of capital letters initially to the child. So you're using a rectangular slate. Preferably you use a smaller slate. I use a slate which is from one of the programs, that is Handwriting Without Tears. But suppose you have a smaller slate, that also would suffice, and you can divide it into 2 parts. Now on the first part of the slate, you make a cue point at the top corner. So on the top corner, and you have to say you are teaching the letter E. So when it is at the top corner of the slate, you only first write E. The parent or the teacher or the caregiver writes E. So he makes a standing line, and the letter language is used. So top standing line, going down, top sleeping line, middle sleeping line, and bottom sleeping line. Now, once this you have made with the chalk, the child is going to use a wet sponge. So he will take the small sponge, dip it in water, or either the parent does it. And then the child is going to trace on that E with the wet sponge. So in the similar manner only. So starting from the cue point, standing line, top sleeping line, middle sleeping line, bottom sleeping line. After that, he's immediately going to take the paper napkin, small piece of paper napkin, and trace on that wet surface. So standing line, top sleeping line, middle sleeping line, and bottom sleeping line. And then now there is an impression of E on the slate already. The child takes the chalk and writes the E on the impression. So standing line, top sleeping line, middle sleeping line, and bottom sleeping line. So child is repeating this 3 times with different mediums, and already the impressions are there. You are not giving any kind of dots to join the lines, but you are directly writing the letter initially. The first time you may have to support the child physically with your own hand, but after the child gets the technique, the child may trace on that particular part and write it correctly. I have seen that happening, and from experience, I have found this technique very useful. So this is called the wet, dry, try technique. Wet is the sponge, dry is with the dry tissue, and try is when the child is trying himself and writing with the chalk. I hope that helps.
Thank you so much for elaborating on this technique, ma'am. I'm sure it would be useful for many of them. Now we have a question by Marlene Jolondo. Says that when we have to start teaching handwriting, can you suggest what letters do we start from? Is it okay to start with vertical letters followed by horizontal letters and then curve, or is there any other method in which we could initiate writing of letters?
So developmentally also, it is better to start with letters which are horizontal and vertical. So usually I would start with uppercase letters, not lowercase, but uppercase letters, because they are simpler to teach. They always start at the top. So I would say you would start with letters like E, F, H, L, which are simpler to teach and which require standing lines and sleeping lines. And then move to P, B, D, R, where you just make a half a circle or two half circles or one, circle means a semicircle. So you start from uppercase. You first start with letters having horizontal and vertical lines, and then you move to these kind of standing lines with half a circle. Then you move forward with other letters where there are curves like C, O, Q, G, where there are curves, and which start from the center of the square. When I'm talking about these letters where there are vertical lines, I may start from the corner of the slate, but in C, O, Q, G, you start from the center of the slate or the center of the square before teaching. So it is better to teach uppercase first. Second, it is better to teach lined letters, then go on curved letters, because development also takes place in that particular manner. After teaching this, you can go to lowercase letters. Now, since you have already taught uppercase letters, so what are similar uppercase and similar lowercase looking letters are C, O, S, V, W. They look the same except in size, in uppercase and lowercase. So a big C and a small c, the formation is the same except the size is different. O and O's, big and O's, the formation is the same, size is different. V, S, W. So it is simpler to teach those letters in lowercase first, which are similar in nature, and then move on to letters which change forms in lowercase. Again, for lowercase, use a double-lined book rather than a four-lined book initially, because that is very confusing to the child. Have enough space for the child to understand, to form that letter before reducing that space. So I think that would suffice. So
thank you so much, ma'am. We'll take the last question for the day. So this is by Chindaran Badal. He states that his son has a dependency on him to hold his hand to make the child write. So the son depends on the hand of Chindaran Badal and won't write without the parent holding the hand. How can we remove this dependency? Any advices from your end?
So this again requires an assessment in itself, whether the prompts are required only in writing or prompts are exhibited even in all other daily activities of daily living or throughout the day. How much is the prompt? How much is the waiting? Or like once the prompt is given or once the child is instructed to do something, how much time is the parent waiting for the response to occur? These are two main things to see. Usually when there is prompt dependency, that also has to be removed slowly and steadily. So initially there is a full physical prompt where you are touching the child on the hand and making him write. Then you reduce the prompt and you're just touching the wrist. Then you're touching the elbow. Then you're touching the shoulder. So just you touched, the child knows to write, but that touch is required before weaning of this prompt into a verbal prompt. Okay, and then before weaning of the verbal prompt into no prompt at all. Now this requires a lot of time because the child is used to that kind of prompt, and that requires also patience from our end, that it is okay, the work is not done, but still I'm not going to give the prompt. So that's like a practice sheet you are doing, and you are trying to inculcate that particular thing in the child, that the prompt is not going to be given. So you need to finish this. So first this, then that, then there should be a proper reinforcement strategy in place when the child does it on his own. So the child gets motivated. Okay, without the prompt, I did this, I got a good reinforcement. Let me now try further. So it requires a lot of patience from the parents, and it requires good reinforcement strategies, and it requires the time given to the child for processing that information that has been given to him before the second prompt comes in. So all these matter when you want to reduce the prompt, and especially when you're working with the child on the spectrum.
A step-by-step fading of the support is extremely important, and that will help. Thank you so much, Dr. Neeta, for patiently answering all the queries from our participants. And thank you, dear participants, for being there throughout. Now, I would request my team member to post the feedback link. Please do drop in your feedback, where 5 stands for you really enjoyed being a part of the workshop today. Dr. Neeta, any words for our participants from your end for today?
Thank you so much for being an engaging audience. As I said, thank you so much for being there, being present, and asking such relevant questions. Sometimes even I have to go deep inside and think about strategies. So thank you. It's a good learning for me also. And thank you, Team Ability, for again having me.
Thank you so much, Dr. Neeta. Before we end the session, I would like to remind you all about our upcoming sessions. On the 15th of March, we have Building Expressive Writing Skills in Children with Special Needs, the basic level. And on 31st of March, we have Enhancing Expressive Writing Skills in Children with Special Needs, that's the advanced level. These sessions would be conducted by Madam Geeta Gopi N. at 4:30 p.m. India time, 6 p.m. Indonesia time, 7 p.m. Singapore and Philippines time. You could book your slots and also forward the link to those who can benefit from it. Until we see you again, it's a big bye from Team Ability. Stay safe and take care.
Thank you so much.